to everyone. Thank you all for joining us this morning. I think we'll go ahead and get started. If people start to trickle in, that'll be just fine. But my name is Jay West, and I serve as Regional Assistant Director for Undergraduate Recruitment at Mississippi State University. And I am joined by my colleagues here, and we will have this program this morning. And we're very happy that you joined us. We're excited to have some wonderful experts who will enlighten us on topics such as counselor roles and relationships and generalized anxiety and its effect on performance. I know we'll gain some great insight on these subjects, and we appreciate Dr. Wells and Dr. Gilbert for taking time out of their schedules today to be with us this morning. So without further delay, let's begin this magnificent program. Dr. Wells, you can start whenever you're ready.
Okay, I'm not sure I'll be doing this right, so we'll see. Can you see my PowerPoint?
Have you shared your screen yet?
I think so.
Let me see.
Let's see.
Here we go.
All righty. All right, can you see my PowerPoint?
Yes, ma'am.
All right. Let me start from the beginning so you don't see it all at once. There we go. Good morning, everybody. I'm glad to be with you all. Sometimes well, not sometimes. I'll be glad when we can all go back into seeing folks face to face, because that's just the way I like to do things. But it's amazing how we can actually do it through Zoom, and that's okay. And we can do more sometimes this way. So I will be talking about counselor roles and relationships this morning. And so part of it is, how do we see ourselves as a profession? Sometimes we're counselors, sometimes we're clients, sometimes we're supervisors, sometimes we're colleagues, friends, acquaintances, and we could probably put a lot more titles here, like aunt, uncle, brother, sister, and all the child verses too. But when we probably look at the true meanings of all of the relationships, we're all of them at some point. So I'll touch on some of those roles. Take a breath and know you are holding strength to help others. When I was at Mississippi State and taught counseling skills, one of the things that I did when they started to see their clients, I would give them a skeleton key, because I would let them know that they hold the key to help others. And I still meet some of my former students and they go, Dr. Deb, I still have my key. But you all are the key to what comes. And one of the things that when I was teaching, a lot of the student affairs students would say, why do we have to take these counseling classes? And I'm going, well, every time you talk with a student, you're counseling. You may not think of it that way, but that's what happens. And it's nice to talk with them now and they go, Dr. Deb, you're actually right. Yeah. But anytime, whether you're in admissions or housing or even the cafeteria, and you're talking with a student, you're doing some sort of counseling. Okay, relationships with the client that are in addition to the counseling relationship. And this comes from the ACA. And typically, the older codes, any relationship outside of counseling relationship was seen as negative. And of course, it says older codes because the code now, the code of ethics is from 2014, and they're probably working on another update. But before the new code, it was very rare that anybody would have a relationship with someone outside the counseling environment. And they were to be avoided because of possibility of impaired judgment for the counselor, where the client could be exploited. And sometimes this happened. Being on the licensure board, this did happen. We had to remove some folks' license because they didn't pay attention to the impairment of clients and did impair a client. So there are ethical breaches in the area, and those were most prevalent. And the exploitation of sexual relationships has given a negative connotation to dual relationships, because sometimes when you talk about dual relationships, you go, no, I'm not in a dual relationship. Well, what dual relationship means is not necessarily a sexual connection, but you have a connection with someone that you go to church with. You have a connection with someone that you're in a social setting with or in a civic organization with. So we have to be careful about how we think about dual relationships. Okay. Counselors understand that the profession of counseling may no longer be limited to in-person, face-to-face interactions. And that's kind of what I was talking about earlier. When we don't actually see them face-to-face, we do online or through the telephone or what have you. And so during, especially the time with COVID, we've been actively trying to understand the evolving nature of the profession with distance counseling and the technology and social media and how these resources can be used. Excuse me. Counselors strive to become knowledgeable about these resources. What's exciting from me and the other two counselors that work here with me at Mississippi University for Women, we learned telemental health long before COVID. So it was really neat because when COVID happened, it was kind of like, well, yeah, we're set, because we could already talk with our students and when they were at home, unless they were in a different state, and then we couldn't because of our licensure law. But anyway, counselors are trying to become more knowledgeable, and they understand additional concerns related to distance counseling, technology, social media, and we need to protect the confidentiality and meet legal and ethical requirements. One of the things that when you take the telemental health counselor, not counseling, but certification, they really want you to know that, granted, you may be talking with a client, but where is that client? Who else is in the area? Who else might walk through? And where is the emergency session or section for them? So if something happens while you're talking with them, who can they contact, or who can you contact when maybe something happens? Haven't had that experience, thank goodness, but it's something that when you meet with a client through video, you want to get that information. Okay. Not all outside contacts with clients is illegal or unethical, but it does warrant scrutiny. We don't want to exploit clients, and we don't want to give the appearance of impropriety. And we want a level of coercion or influence over a client. We don't want that either. Of course, one of the things that we're definitely aware of, especially with YouTube and Facebook and all of the other things that are around social media, we've got to be careful of how we appear, because we might be doing something and like hugging an individual, and it's very innocent, but we don't know what other people are seeing. So we've got to be careful as far as the appearance that we give. So we don't want other folks to say that, oh, well, you're coercing that client, or you're trying to have over influence over that client, because that's not the idea. I do want to say, though, too, is one of the things when we become counselors, we have a certain amount of power that comes with the title of counselor. And so that's one of the things, too, that we have to be careful with, and not to take advantage of that. Again, being on the licensure board, some of the people that we reprimanded or were concerned about did use their power to hurt clients. And so that's just not what we need to do. So what we need to do is, like the quote says, that the benefits the counselor while it compromises best interest or well-being of the client. So, you can think about different things and what will be the well-being for the client. Some interactions may actually be seen as beneficial. Family ceremonies, graduations, weddings, funerals, and I've been in a lot of weddings, and go to graduations and funerals, and just other things that the client will be beneficial if you're able to go. And sometimes when you go and maybe they don't expect you to be there, it means a whole lot to them. But then we have to be careful too when the interactions can lead to detrimental relationships. And sometimes we get too close to clients, or clients get too close to us, and we're not able to put up the boundaries that we need to put up. But that's something to think about. There's no reason, as far as sexual relationships, to engage in a sexual relationship with a client. There's no reason. None. Zilch. Nada. Dead. It puts clients in danger of emotional harm. I mean, just even when clients become attached, because sometimes clients do become attached to us, it's not a sexual relationship, but depending, as long as if we don't put the boundaries in place, it may harm the client emotionally. So along with other things, counselors, you need to realize we have to put boundaries in place, because we don't need to misuse that power. Clients are emotional and vulnerable. You think about it. These people come, and when they open up to you, they're opening up their heart. They're opening up their feelings. They're opening up the experiences that they've had, with the trust that you're going to keep it confidential, or the trust that you're going to help them find something to remedy the situation. We have to be careful when clients get too close. Sometimes we are seduced by a client. And again, we need to take those precautions. You think, oh, well, nobody's going to love me. Well, don't necessarily think that, because sometimes clients go, well, this is an easy one, and may try and seduce you. So again, boundaries are very necessary. So you take any semblance of non-professional relationship. And so part of it is, keeping your door ajar, co-counseling, recording a session. And of course, you have to be careful about recording a session, because where's that recording going to go once the client leaves? And who's going to witness if there's someone that's really trying to get to you, and if someone's really trying to be malicious? One of the things here at the W is all three of us have a separate office. And of course, like I told skills students back when, always have a way to get out of your office without having to pass by a client, especially if you're concerned about it. So part of it too is having a signal that you feel threatened or you aren't comfortable with a client. And sometimes you'll know that beforehand and can tell other people. But with clients coming in, some, but maybe few might be malicious. Of course, it's a symptom of emotional disorder. But one of the things too is, as counselors, we have a lot of intuition, and trust that intuition. If you don't feel good about somebody, 10 to 1, that's what your intuition is trying to tell you. Be careful. I'm getting preachy. Sorry, y'all. Use cautiously, use appropriately, always ask, and have a witness during therapy if indeed you feel threatened. Okay, are we our colleagues' keeper? Yeah, we are. Code of Ethics said if there's something that you have problems with another counselor, or you see something that you're afraid or fearful of that counselor, you should go to them before you go to anybody else and talk with them about your concern, because that counselor would rather hear it from you because you care about them than hearing it from somebody else, or like even the licensure board coming to them. Well, we received a complaint and here it is. When the complaint that is to the counselor, they had no idea. So always go to your colleague and confront them first. And then consultation is always appropriate before you go to, the licensure board or anybody else. And if there's no change in what you see, then yeah, you're obligated to report the serious infractions or whatever that concern that you have. Oops. All right, supervision. One of the things that Mississippi has are approved supervisors. And so one of the things that we're able to do is to supervise counselors that are wanting to become LPCs. And supervision is one of those things that I enjoy, because it's nice to know that we can influence or have an influence in someone else who's coming into the profession. And so one of the things too is, as a supervisor, you might have one or more roles, because you're a supervisor, but then you might be in private practice. So you change hats from being a private practitioner to a supervisor. So when you change your hats to a supervisor, you need to let them know the expectations of being a supervisee. The informed consent, consultation, supervision, documentation. And this is with anything. Granted, the informed consent is one of the things that we need to do with our clients as well, but then we also need to do it with our supervisees. And of course, there's a power differential. I can't pronounce the word. Differential. Some of the roles will be non-professional, which is just fine. But then in the professional realm, have open discussions, relational documentation, potential benefits, the drawbacks, anticipated consequences. Sometimes we fail to look ahead or anticipate what the consequences might be. And then sometimes there's some unethical relationships. The supervisee's judgment is impaired when they might be having a relationship with a client. Because supervisees, what's interesting being a supervisor is if something happens with that supervisee that might be unethical or what have you, it comes back on your license as a supervisor. So being a supervisor is kind of scary at times because you really want to be able to trust your supervisees, which is even more important reason to declare the expectations of the supervisee or the risks. And then sometimes too, as a supervisor, you risk exploitation of a supervisee. You don't want to take them for granted. You want to make sure that what you're teaching is what they need to learn. And sometimes expectations may be incompatible, and then the responsibilities will be incompatible. So the expectations and responsibilities need to go hand in hand. Other relationship issues, sexual attraction. Again, I said it can happen. Be prepared. Then let the supervisee know what to do, because that's something that they will be surprised. Sexual harassment, supervisors should never put their needs before their supervisee, just as any counselor should not put their needs before any of their clients. Hidden consensual sexual relationships, no. Is the supervisor's judgment impaired? Is that something that's happening and the supervisor just doesn't think it's real and it's not going to happen? And then there's also conflicting professional relationships. Supervisors should not serve as counselors to supervisees. As a supervisor, sometimes this is very difficult because depending on what the supervisees are dealing with in their clientele, some things might come home to haunt them. And they are dealing with something that they really haven't ever dealt with, but they're having to help that client deal with some things. So that can come back to supervision when they come in and go, boy, I had dealt with a client this week and it was very difficult because they were going through some of the same things that I need to go through. So, and at that point, you can't be a real counselor to your supervisee. You can give them options maybe, but then they need to be able to go to another counselor, not as a supervisee to a supervisor. Relationships with former students. I have relationships with, and that's where you get confused. Relationships, what kind of relationship? No, you have, students. I mean, Corey and Jay are former students of mine, and it's wonderful to be able to have discussion with them or to talk with them or know that I can call them up and say, what about this? So it's wonderful. I love the idea of being with former students. Okay. Avoid multiple relationships if at all possible. And school counselors, this is one of your things. Again, you have informed consent, consultation with other professionals, supervision. Maybe you're needing some more supervision. Granted, you may be a supervisor, but who's doing supervision for you? And then, of course, documentation. There might be incompatible roles, and that drastically decreases the effectiveness of being a school counselor to some extent, because how much do you know about the relatives, close friends, associates? So know what relationships, know what consequences might come from knowing the relatives, close friends, and associates. School counselors are responsible to protect clients from risk. And that's where they monitor relationships closely. And the one thing about a school counselor is you can see where students are hanging with different people and know that those people that a particular individual is hanging with is not necessarily a safe person. But then you can gauge those benefits of counseling very carefully. It may be wanting to bring that student in. And so you send a note to that class that you would like to see a client or see a student, but gauge it. You don't want to take them out in the middle of class and then be embarrassed because they've been taken out of class. And of course, then there's the other way around too, that they want to get out of class. But you have to take that very seriously and carefully. Okay, some ethical terms for school counselors as to an ethical decision. Identify who is the client. And this is one of the things in counseling couples. You have to identify who's the client if indeed you're seeing one of the couples individually. If you're doing marriage counseling, the marriage proper becomes the client. So when you are seeing a child in school, garbage truck, that they are the client. Clearly identify the issue or the dilemma. What's happening with that client? Is it something that they're imagining? Is it something that's really happening? So you're all things when you're a school counselor because of how you can see a lot of different things that are happening. And note that you can consult. There are different laws, there are different codes, policies, and even other professionals. What are they doing? What are they thinking? And of course, think carefully. I have a button that says, think. It's not against the law. So school counseling is not easy. Okay. The social system, systematic social system, primary cause of disturbance. You want to be able to affect positive change, not just, oh, well, they'll work it out. Not if they've come to you, they're wanting you to help them. Now, granted, we're not supposed to give them advice, but to help them come to their own conclusions as far as what needs to happen, to affect positive change. And one of the things that we are tasked to do is to have continuity and to have loyalty with clients, with any of the relationships that we have. Because if we don't have that continuity, then our clients or other people in our relationships and our responsibility won't know, well, is that true, or was that something that you did on your own and not true? Part of it too with responsibility is loyalty. And that can happen in many different ways. Okay. Whoops, sorry. Okay, recovery. Sometimes we as counselors might have an alcohol problem, might have a gambling problem, might have even somewhat of a drug problem, or even a spending problem. And this is something that I've seen several students here at the W, is that they have a spending problem. They cannot get away from spending. And of course, Facebook and Amazon, oh my, and Etsy and all these things, so it may even be coming to that. So know what you have, if indeed you have an addiction, because some of the issues may be confidentiality and anonymity, so if you're going through recovery, know that if someone else sees you, it's not their right, it's not their job to be confidential. And so be careful and know that they are not bound by confidentiality. And that's the same with as you meet with clients. You can tell them things and they can go and tell anybody else. They aren't under the guise of confidentiality. So it's something to be concerned about because it's always interesting when when maybe you've talked with a client and then they've introduced you in some way to somebody else, or and they hear or you hear the words that you've said to them. So be careful. Self-help groups with current clients, sometimes that's a possibility, and then sometimes it isn't. One of the things that I've struggled with recently is my husband died back in June last year, and a lot of people have gone, well, Deb, are you going to a grief group? No, mainly because I've gone to a couple of groups, and instead of being someone in the group receiving the ministry of receiving the comments, they have not forced me, but they've just assumed that I'm going to take over the group, or that that's my responsibility. And no, it's not. So I've done some other things on my own to get over the grief. And some of it is I've got other colleagues that I can talk with, and they have been very helpful. And that's where the relationship with our other colleagues can come and be very important. And then even employment. So if you have an addiction, how is that affecting your employment, or is it? So what are you going to have to do? Minimization of conflicts, clinical supervision, consultation, those are always available. Then pay attention to client treatment and needs, and consider the counseling relationship. What does the client need in recovery? What do you need in recovery? Okay. Rehabilitation, activities with clients. Now, granted, there's voc rehab, and which is part of a lot of counseling departments, and because it's another thing that people are do for their vocation. Counselors do, and sometimes it's vocational, and which means, well, one of the things that's happening with me now is my MS has flared up, so I have to, or I've been able to, I guess I better say, I have a scooter, so I can scoot around campus instead of having to walk. And one of the things that I guess I realized that I didn't realize when I was teaching is a vocational counselor will make sure that you can work. If something is wrong with you or a disability and it may prevent you from working, they will do whatever they can to make you able to continue to work. And that's one of the things that the voc rehab counselor for me did. She said, Deb, if you can't get to different places on campus, well, you still have a job. Well, not really, because I need to get to those meetings, or, get to that client or get to that student. So being able to have a scooter to get to the meetings or clients has been beneficial. And of course, that way I know my position here, my disability is not preventing me from doing my job. Okay. Of course, this is an opportunity for clients to challenge boundaries, because a lot of times you're out of the office with voc rehab, and so the challenge to boundaries will be there because you're not in an office, you're not in in a closed room, or, nobody else might be there. And so there's out of the office contacts. So rules are established, and they're shared with the client and their family, especially if you're meeting the client and their family is present. And reinforce and document regularly. The supervision, training of possible problems and responses. Encourage disclosure of boundary issues. If there's an issue that a client is having with the boundaries that you've set, and then talk with your supervisor and say, I've tried to set those boundaries, but this client will not adhere to the boundaries I've set. And so it may be time for, if indeed your supervisor, to get that client involved with someone else as far as their therapy or their rehab. And again, document potential benefit and consequences. Some are rational, and then possible intervention if unintentional harm. All righty. Questions? Answers?
If you all would like, if you have questions for Dr. Wells, you can put those in the chat and we will be able to answer those for you.
No questions? Never hesitate to ask.
If you all have questions, like I said, just put them in the chat and we will address them as they come in.
Yeah. I know I didn't give the answers to everything, but hopefully, if you have questions, you have other folks that you can consult with. Never hesitate to consult.
Dr. Wells, I do have a question maybe that someone may want to know as far as being a counselor in schools, or even a licensed professional counselor. You talked about boundaries and you talked about setting those boundaries. How early on should you do that? Should you do that at the beginning? When setting boundaries, if someone is walking over those boundaries and not paying attention to what you told them, how do you address that and not come off as being rude or mean, but you're just trying to, make a point that that's what the boundary that you have set for them?
Part of that, Jay, is don't worry about being rude or mean, because if indeed they're going against or going over those boundaries, that may be what they need. Is, no one else has stood up to them as far as them going over boundaries. But if they're going over boundaries with you, this is no longer appropriate. You may not do this any longer. If indeed you continue to do this, then I cannot meet with you, or I cannot be your counselor. You've got to be as strong as possible. And granted, you don't want to be rude, but still, if they've come over those boundaries, time and time again, then it may be time for you to part, or for them to find another counselor or another therapist. Did that help?
Yes.
Thank you.
Do you typically have relationships with, I guess, with your students, their parents, or anybody like that? We mentioned and you talked about relationships that you could have, or do you just keep it limited to the client that you're working with?
That all depends on the issue. Like last week or the week before, we had someone that didn't attempt suicide, but had suicide ideations. And of course, we were very concerned. And one of the things that we did with their permission is we talked with their parents. And actually their parent came with, and we had a session with the parent and the client as well. So we were able to have a relationship, not only with the client or with the student, but also form one with the parent. So a lot of it just depends on what's needed at the time, as long as it's appropriate.
Thank you for that answer.
Yes, ma'am.
Are there any other insights that you have, Dr. Wells, that you would like to share with us?
Love what you do. And when you no longer love what you do, it might be time to change, or it might be time to figure out, why don't you love it? And what is preventing you from enjoying or loving it? Because life is too short not to enjoy what you do. Life's
Yep.
way too short.
Oh, yes, it is. That brings me to a question that you just said. When you might be in a situation where, let's say, you are in a profession that you may feel you're falling out of love with, how do you handle that gracefully? And your students, you have formed relationships with them, their families, you're working with them in the schools. How do you gracefully just bow out and try to transition into something different?
First of all, consult with other professionals, with the colleagues that you have. Is it something that can be fixed, or is it just you're tired and you're burned out? Because that may be where you just need a little bit of energy. But if it's something that it's time for you to leave, then just be very gracious to the colleagues and clients and families and say, I need to take care of myself. And in order to take care of myself, this is a change I need to make so I can continue to help other folks. Because if I don't help myself, then I can't help you, which is something that everybody needs to take into consideration as far as their own welfare and their own wellness as clients, or not clients, as counselors. So please take care of yourself. Sleep, water, all that type of thing.
Yes, I think we often forget that when we're taking care of others in so many ways, in the relationships and the roles that you say that we play. I think we often forget that we have to think of ourselves, because if we don't, no one else will.
That's right. Yeah, very true. Very true.
Anyone else have any insight or any questions?
Sorry, I could have done 4 or 5 more slides, but
I'll just tell you, Dr. Wells, we do appreciate you on behalf of the SACAC and State and Area Initiatives Committee for taking time out of your day to come on and speak with us again. For those of you who are in attendance this morning, Dr. Wells graciously did a presentation for us for the SACAC-wide drive-in workshop last spring, and did a great job of introducing some skills that we can use in our daily lives to make sure that we're not receiving sort of a burnout. And so it's kind of nice to see this full circle moment where we talked about burnout and strategies for being able to stay in that job and stay rejuvenated, to now kind of go into another layer of that same discussion and talk about the relationships. And as Jay is asking here, how to maintain a good relationship within your workplace. Because if those coping strategies maybe that you taught us about in the spring are no longer working, now it's not maybe time to assess what those relationships are, and is it really still benefiting you, or is it time to move forward? So thank you for that. I think it was really good. Jay, I think I may have seen a hand raise.
I did too, Corey, and it says they believe the chat is disabled. Hold on one second. Let me see. Okay, it should be on now. The person who had their hand raised, you can ask the question if you would like.
You will need to type the question, just I think because the panelists are the ones who can speak in this webinar style, but I think you can type your question.
Let's just see. Well, if there aren't any questions or concerns, we do appreciate you stating that you enjoyed the presentation. So thank you for that. And Dr. Wells, again, like Corey said, thank you so much for joining us this morning.
Sure.
We really do appreciate you. I think you reminded us of a lot of different things that we need to be focused on as we go into our daily lives, even, not even thinking about just the counseling roles, but as we live our daily lives. So we appreciate you. And if there's ever anything you need, let us know.
Well, thank you. I appreciate you all and the work that you're doing, because it helps. It makes me feel good that it's continuing. So that's just neat. So thank you, Jay. Appreciate it. And y'all have a good day. Bye, all.
Bye.
Was that okay, Jay?
Yeah, I think that'll be fine. Corey, I was going to ask you, did you have any updates or anything?
No updates from me right now. We are, I guess the only thing that I would encourage people to do is continue watching for the Wednesday emails that are coming out from SACAC, because there's a lot of really helpful tips in there for upcoming events. We've got our annual conference that's coming up in April in Jacksonville. And so if you haven't registered for that yet, there's still time. And, that's a great time to really participate and hear about sessions just like this, but there's all different types of topics that take place at the annual conference. And I know for me, I love going to that conference because I'm able to sort of get rejuvenated in my own work. It's nice to be in the company of people who share the same types of struggles and victories even that we do. And sometimes our direct supervisors may not be in the trenches quite like we are. And so they may not know how to address or answer certain questions or relate to certain things that we're describing. And so it's always a good time for me to go and meet up with people who are essentially doing the same type of work that I am, and we can bounce ideas off of each other. We can talk about things, talk through struggles, and just really be a support network for each other. So I would encourage you, if you haven't actually done that, you please feel free to register for that. And for some of you, you may be sitting here saying, I would love to go, Corey, but my school district is not going to be able to fund that. Well, through the Extending the Dream SACAC grant, that is what that is for. So essentially, it's a way for us to provide professional development funds for people who are approved for that. There is an application process. And so if you need to recall some of your emails, there was an email that just went out yesterday morning, actually. The basics of the Extending the Dream SACAC grant application. That application will close on February 22nd, so next Wednesday. So you still got time to submit that if you are interested in participating in the annual conference. If you're interested in participating in any of the SACAC events that have a registration fee, you're welcome to submit that application.
Corey, I have a question about that, just in case someone is wondering. With the Dream Scholarship, does that only cover your registration?
Generally, it covers registration. You could, let's see, grants typically range from $500 to $3,700.
Okay.
And so, yeah.
If you're looking for a way to get to SACAC, guys, I think that'll be a good one for you.
And that's all the updates I have for right now. Like I said, if you're just looking at those Wednesday events notifications, then you can also see a list of everything that's going on. SACAC is busy, y'all. And so with all the different committees, and so we're busy trying to develop programs and initiatives that can help our membership regardless of what type of role that you have. So we want to be a really good resource for our membership. And that's another thing. If you are here today and you're not a member, it's fairly easy to join. You can join online through the sacac.org website. And if you are a public high school counselor, there's also a way for you to have your membership fee waived through the free access membership opportunity. So definitely check that out and stay abreast of everything going on.
Thank you for that, Corey. You all, we are waiting on our second presenter. She should be in just a second. So if you do have questions for Corey concerning SACAC or anything in ways that you can get involved, I think, like he said, becoming a member and actively attending conferences and things like that really help you with networking and getting to meet other colleagues that you may work with that you may not see every day. And so I think that's something that a lot of us do appreciate about SACAC for sure.
And for everyone that's here, while we are waiting, if you need to take a restroom break, go grab some coffee, do whatever you need to do while we wait on our next presenter. Jay, I need to correct myself real quick. So the Extending the Dream grant is actually not for the conference. I was getting my two grants mixed up. So the Extending the Dream is if you're a high school counselor and you are wanting to put on a program. That's what that one is. So let's say you're wanting to put on an ACT prep workshop and you need you want to provide some resources for that. You want to get that program up and running. Let's say you need some calculators for a certain program. Those are what the Extending the Dream grant could be used for. What I was meaning to reference was the Counselor Participation Fund, and that deadline has passed for this year. It was January 10th, but you could still be on the lookout for that in the future. That is something that is used for annual conference. It's also used for not only the registration fee, but the lodging, transportation, meal allowance, depending on the needs of that recipient. And it's also can be used, like if you're wanting to participate in the Sweet Tea Tour, that's always a great summer development program or summer seminar. Those are the programs that the Counselor Participation Fund covers. So I just wanted to make sure I corrected myself on that.
Thank you so much, Corey. We appreciate that. And I think you all providing funding for different programming ideas that counselors may have, that's a big plus, and that shows that you all support what the counselors are doing in the schools and everything along those lines. So we appreciate you all for sure. And while we are waiting for our next speaker to join us, I just want to say thank you to all the counselors out there who are with us today. I think a lot of times your work may go unnoticed, but we notice it. And things, maybe you may not always get that thank you that you should receive, or the pat on the back doesn't always happen from a supervisor or someone in your school, but just know there are people who are thinking of you and everything that's going on. And thinking about that, I know some of the schools are closing because of bad weather today. And we just want to say, we hope you stay safe, and all the things, things don't get as bad as they're supposed to get, for sure. Our next panelist or speaker is having an issue with getting in, so I'm trying to walk her through that. And as soon as she gets in, she will begin. Yes, Miss Diana, you have your hand raised.
I'm here. Let me turn, sorry, let me turn one off. Can you hear me?
Yes, ma'am.
Good. All right. Sorry about that.
Let me see if I can get your video going.
Okay, there it is. Okay, can you see me?
Yes, ma'am.
Make sure it's level. All right, here I am. Okay.
Great.
Yeah.
I can actually do the presentation PowerPoint for you, and you just tell me when to switch the slides, okay?
Okay, all right. So I could just say next, I guess.
Yes. Mhm.
All right then. And then there's that one little handout that I had. The remember you asked me for the QR code?
Yes, and Dr. Gilbert, we sent in the email, SACAC did, everyone. There was a activity that she wanted you all to do. So if you all have that information, I think she's going to discuss that today as well.
Yeah. We'll I'll have them do it at a point in the slides. When we get to a certain slide, I want them to complete the activity.
Okay, let's see here. Trying to see how to mute myself. Okay, you just let me know when you're ready, Dr. Gilbert.
Okay. All right. So welcome everybody. I see a number of participants. If you have any questions, I'm just going to ask you to put them in the chat. Can you hear me okay? All right, yes, all right. So I'm going to ask you to put any questions that you might have in the chat, and then when we finish, I'm going to try to allow a few minutes to try to go through some of those questions and answer them as best as I can, okay? So a little bit about me. I'm in my office right now. I'm a psychiatric nurse practitioner, and I work in collaboration with a psychiatrist in the state of Alabama. I guess you all are in Mississippi, but in this state, and I believe in your state too, a nurse practitioner has to work with a collaborating psychiatrist for prescribing medication. So that's what I do. I treat, diagnose, and come up with a treatment plan for clients that have mental illness. And a lot of what keeps me busy is things like anxiety, depression. I have some patients that are suffering from bipolar, very few with psychosis though, which is handled more by an organization called Wellstone, which is here in Huntsville. And they would be treated by psychiatrists, nurse practitioners, and therapists there. I work in collaboration with therapists, and I have some training in cognitive behavior therapy as well as EMDR, which is kind of hot right now. EMDR is the eye movement reprocessing desensitization treatment that we use for clients that have post-traumatic stress disorder. So, Jay, if you can pull up the slides, I'll start talking. Today, I wanted us to focus a little bit more on anxiety, because I think a lot of our students are suffering, obviously, from depression and anxiety. We know that COVID has really offsetted the mental state of many individuals, and students in particular are having quite a hard time going to school and studying. So I want you to be a little bit more aware of some of the symptoms. And since you guys are counselors, I'm sure you're already familiar with a lot of what to look for anxiety. So this might be just a review for you. But anyway, I want us to kind of have a good discussion about what you're seeing, what I'm seeing in my practice, and what we can do to kind of help students make it through this difficult period. At this point, we're dealing kind of with the post-traumatic stress of the pandemic, and we're seeing quite a bit of issues with focus and attention, which could be related to anxiety, but it also can be related to depression and other disorders. So that's kind of what I do in a nutshell. And
Okay, Dr. Gilbert, I just figured out something. I didn't even click share screen. So let me do that right now.
Yeah, you have to do that. You're gonna have to do that so they can see the PowerPoint. I wish I could see you guys. Let's see. Okay, here it is. All right, so I've entitled this presentation Anxiety Post-Pandemic because I think that there is some, fallout from the pandemic. Next slide. There we go. All right. So, I did a little bit of research. I didn't have a lot of time to do extensive research, but from what I've learned, this is some data that was compiled from the CDC of 2022. So things might have changed in 2021, 2023. We just started this year, but last year, according to the new data in 2021, more than a third, about 37% of high school students reported they experienced poor mental health during the pandemic, and 44 reported they persistently felt sad, hopeless during the past year. The new analysis also describes some of the severe challenges youth encountered during the pandemic, such as 55%, okay, so that's half of the student body reported experiencing emotional abuse by a parent. So think about that. When students were in school, going to school, they typically had some relief from some of that encounters that they were having, maybe with an abusive parent. Now they're sequestered. This is during the pandemic. Now they're sequestered in the house. There's more exposure to trauma, more exposure to those stressors that they were feeling. So some students reported that they were even experiencing things like, being hit, insulted, being put down, all those negative words that were being said to them, which they would escape by going to school. Now they're stuck with that parent at home. So increase in anxiety and depression. 11% experience physical abuse by a parent or other adults in the home, including hitting, beating, kicking, or physically hurting the student. Think about those that were experiencing sexual abuse and how awful that would be. More than a quarter, 29% reported a parent or other adult in the home lost a job. So some financial stressors. Next, Jay. And what we found is that household composition was an important factor associated with anxiety during the COVID-19 pandemic, as people were spending more time at home due to physical distancing and lockdown. We found that mothers that were, we have a lot of students that are single parent homes, and majority of them probably mothers trying to raise kids, and those households tend to have a greater percentage of anxiety. Women tend to be more worriers. The statistics is like 2 to 1 in comparison to men. Women are twice as likely to suffer from anxiety and depression, more so than the men. Next slide. Okay, so some of the common health obstacles that we were seeing is loneliness. Students that were first timers, think about first generation students that are going away from home to colleges, experiencing loneliness. And we know that students that are of other races other than Caucasians tend to feel more isolated, not integrated into the student body. they experience greater sense of loneliness, but loneliness in general was up by 63%. Of the college students reported feeling very lonely in the last year. And that was cited by the American College Health Association in 2017. So think about that. That was like way before the pandemic. During the pandemic, those numbers should have increased even higher. Anxiety, nearly 30% of the students reported feeling overwhelming anxiety in the past 2 weeks. And then depression rates went from mild to moderate to even severe depression among college students as they watched other students become ill. Some students, probably died. We know that young people were a little bit more resilient to the pandemic. But, I knew of a case of a 21-year-old who came home from his class one day and said he didn't feel good, went to his dorm room and passed away, unfortunately. So it wasn't just older people that were passing away from the pandemic. We did see some younger people. And this had a tremendous contributing factor to the anxiety level that students were feeling. The suicide rate is always scary for me around young people, because they tend to be, they tend to get into this mindset that things are always going to be this way. It's never going to change. Very fatalistic, hopeless thinking that can set in as a result of feeling depressed or anxious. The suicide rate among the ages of 10 to 24 increased 56%. Imagine that. And between 2007 and 2017, this was cited. So that number again is probably higher as we look at the pandemic and the fallout from the pandemic. 53% of college presidents listed students and mental health among their budget COVID-19 related worries. Next. Okay, so this was just to kind of point out that there is a big difference between non-whites. Brown and Black people suffer from higher loneliness, which can contribute to the suicide rate. The highest, you can see here, 23.9% was experienced by non-Hispanic Americans. Indian and Alaskan natives have the highest rate of suicide among younger people. Next. Okay, so just, because we have to think about gender differences as well as ethnic differences in terms of how we manage stress and anxiety. We know that African American youth whose anxiety levels are elevated by everyday struggles of just being who they are, encounter struggles they encounter will overproduce the stress hormone cortisol. And we know that, years and years of being under a lot of stress does contribute to health issues. I call these kind of diseases of adaptation. So when your stress levels are so high and you are producing all this cortisol, which is circulating in the blood, we can see things like higher blood pressures, higher pulse rates, and even a predisposition to diabetes. Over years of this kind of exposure, it's not unusual for people to develop things like heart disease and high blood pressure and diabetes. So we want these levels to come down, and we want to really start this early in life. Most of what I deal with in my clinic is related to things that happen in middle school, during those times when you're formulating your identity. You're liable to start to think in negative ways. And so when those things are overlooked and they don't seek a counselor like you in the schools, they just try to deal with this themselves. Years and years of this stress level does contribute to major healthcare issues. Next. Okay, so overview for today is we want to talk about anxiety a little bit more. Mild anxiety, is permissible and sometimes even encouraged, because like I was presenting this presentation today and I was mildly anxious, which motivated me to try to get myself together to do this. So we accept mild anxiety, but however, when people frequently experience intense, excessive, and persistent anxiety, we call that, now it's getting into the moderate to severe range, and that's when we really have to treat it, especially worry that is, you worry about things, but it shouldn't get to the point where it's excessive and you can't focus because you're just always worried about your child or your finances or the car or whatever it is. And so that persistent worry and fear about everyday solutions now contributes to these major stress hormones. This is characterized by a sudden feeling of intense anxiety, fear, or terror that reaches a peak within minutes. Okay, and that we call that now a panic attack. Of course, you should be familiar with this: the heart racing, the shortness of breath, feeling like you're going to pass out. That's what and then we fear even having another attack. So that's different from just moderate to severe anxiety. That's panic. Sometimes people tell me I had to run to the emergency room because I just felt so horrible. Felt like I was having a heart attack. These feelings of anxiety and panic interfere with everyday life. People don't want to go out because they fear they can't get back home or something horrible is going to happen. The symptoms are difficult to control, and that's the key. Okay, most of us can talk ourselves, out of an anxious mood, but when the symptoms are so difficult to control that they start to control you, it's time to do something about it. Okay, next. Okay, so just a little bit of the anatomy and where most of our anxious mood comes from. We know the amygdala is that's that name right there that's in pink. That typically is the emotional center of the brain. When we pick up on the stressor, it's picked up by the hypothalamus, sends the message to the amygdala, and we have hormones that are kicked in, such as thyroid hormones increase, insulin increases, cortisol, adrenaline. All of this is to get us to move if there was a bear coming at us. We do need this. But when these things are happening and there's no bear, it's all in our head, then we have these circulating hormones that are going to cause problems. And I apologize about this picture. I've realized that it didn't copy completely. So what it should say is the environment and how we interpret our environment is going to be affecting the amygdala and the hypothalamus. Okay, next. So some of the anxiety disorders that I see is generalized anxiety. Okay, that's just you worry. You're just a worrier. Can't control your worrying. It can cause some other issues, some other symptoms that we're going to talk about, I think, in the next slide. Social anxiety, social phobia. A lot of this is highly genetic. In other words, mom and dad, grandparents, you come from a line of worriers. And so, we don't know if it's learned behavior, but we do know that changes in the brain can take place, like lower levels of GABA aminobutyric acid, which is the one neurotransmitter that calms us down. Those levels typically tend to be lower. So we replace those by giving you sometimes rescue medication. I'll talk a little bit about that, I think, in a couple of slides. Social anxiety, social phobia. These kids stay in their room. They don't want to go to class. They are afraid of what people are saying about them. They imagine that people are talking about them. A lot of some of my clients have, they have like a mild spectrum. They're on the spectrum, and so they tend to have problems with communication. They don't know what to say. They don't know how to initiate a conversation with someone. So they tend to, avoid being around crowds. Specific phobias I don't see too much of, but I do see separation anxiety in some college students not wanting to go to college because they probably had that separation anxiety when they were younger and it just was overlooked, and it comes out as they are approaching the college age. There are anxiety disorders that are due to medical conditions, which I think you should probably keep in mind, is that your thyroid, if your thyroid is not producing enough thyroxine, it can lead to hypothyroidism, and that in itself can cause increases in anxiety and depression. If it's too high, on the other hand, it can also cause anxiety, but it can cause more of a panic attack where the heart is racing, shortness of breath, that impending doom, feeling like you're going to die. Very, very uncomfortable feeling. So if you ever see people, students come in with that type of panic, then you should probably refer them to a medical doctor. Post-traumatic stress, we have a lot of students that have been traumatized. Trauma is a generational transmission. We have trauma can actually be, even if the student doesn't experience trauma, hearing about trauma can traumatize them as well. And of course, trauma comes in I think it comes in degrees. You can have what maybe little t, little trauma, and you can have huge, big trauma that is complex. So whatever you experience and how you interpret trauma, that's what you're dealing with. Okay? So I may not be affected by your mild T, but you are. So it's about how you express that. Post-traumatic stress, of course, there's hypervigilance. There is problems with, being just very hyperprotective, not wanting to be around people, suspicious, distrustful, guarded, problems with sleep, nightmares. Okay, so post-traumatic stress, that's like a whole different presentation. It's a lot we can say about PTSD, but some students are trying to go to college with this kind of background. So they need a lot of support, a lot of encouragement, and they should be getting some counseling and maybe even medication management. So if it's that severe. Next. Okay, so some of the symptoms to watch for when you are having a student with an anxiety disorder. So feeling of restlessness, not being able to sit still, okay? Maybe coming into class late because they want to avoid, being there longer than usual. A lot of them sometimes are snappy, they react, very reactive emotionally, overwhelming emotions. So they can be easily fatigued by all of that. Having difficulty with concentration, okay? So they're always, just fiddling, doodling, looking out the window, not paying attention to the lecture. Difficulty with focus and concentration can be other things too, such as ADHD. But anxiety will narrow our focus. It will cause us to not be able to take in information around us. So look for that. Having headaches, muscle aches, so we can have somatic complaints. Okay, remember the neuron has a center, and that's the soma, the cell body. That can express itself in physical manifestations such as headaches, muscle aches, unexplained pains that you send them through a whole bunch of tests, medical tests, and they can't come up with anything. It's all considered normal. So when you see things like that, they tell you, oh yeah, I had a upper GI, and they couldn't find anything, but my stomach really hurts and I'm nauseated and I'm having diarrhea. It's usually anxiety related. So if they're on meds, ask them, did you take your medicine today? How consistent are you in taking your medicine? Okay, because sometimes they're like, oh, well, I took it last week and, I keep forgetting. So those symptoms are not going to get any better. And they may even have to drop out of school if they're having that much difficulty. So all of this is, we want to really think about preventative medicine. Having sleeping problems, okay? Can't go to sleep. Most of the time, anxiety keeps us awake. Depression, on the other hand, keeps us asleep, but then we wake up in the middle of the night. 2 and 3 o'clock, we're up, can't go back to sleep. So sleeping problems, watch for those, ask about those. If that's the case, then we want to make sure that we do something to help out. Exercise is a major component of getting rid of anxiety. I encourage everybody to exercise, and I do it myself. I don't preach without practicing what I'm doing. So, you know how the airline says, before you help your child, put on your own mask. I would encourage you to think about your own anxiety. Okay, anxiety to me is contagious. You come into a room and somebody is extremely anxious, irritable, it affects you. So we want to make sure that we are practicing self-care as counselors. And so I want you to take a few minutes now, and Jay, if you can pull up that handout that I had, the GAD handout, which is just a generalized anxiety screening. And I want you to take just a few minutes to answer that for yourself so that you can be aware of what your anxiety level is like. And most of you probably say, oh, I don't have any problems with that. But sometimes when we see things on paper, it kind of jogs our memory of, maybe I do have that symptoms. So take just a few minutes and look it over and put in the chat anything that you might be aware of that you might experience, or even things that I haven't brought up. Just put it in the chat so we can have a discussion about that. Okay, so I'm going to give you just a few minutes to do that.
Dr. Gilbert, I'm trying to get it up.
Are you?
So that they can have it.
Okay. And if you can't, then I can read it off.
You may want to do that because I think the link is not hyperlinked in the one that I have.
Oh, I see. Okay. All right. Okay, hold on just a second. All right, so let's go over this. So in the past 2 weeks, how often have you been bothered by the following problems? Okay, so you can answer this: not at all, several days, more than half of the days, or nearly every day. So in the last 2 weeks, 14 days, how often have you been bothered by the following problems? Number 1, feeling nervous, anxious, or on edge. 0 is not at all. 1 is several days. 2, more than half of the days. Or 3, nearly every day. Okay, number 2, not being able to stop or control your worry in the past 2 weeks. Not being able to stop or control your worry. 0, not at all. 1, several days. 2, more than half of the days. Or 3, nearly every day. And number 3, Worrying too much about different things. Worrying too much about different things. From 0 to 3. Give it a number, even if it's 0. Number 4, trouble relaxing. Trouble relaxing. 0, not at all. 1, several days. 2, more than half the days. Or 3, nearly every day. Number 5, being so restless that it's hard to sit still. Being so restless it's hard to sit still. And number 6, becoming easily annoyed or irritable. Becoming easily annoyed or irritable. From 0 to 3. Number 7, and this is the last one, feeling afraid as if something awful might happen. Feeling afraid as if something awful might happen. Okay, so if you've checked any problems, how difficult have they made it for you to do your work, to take care of things at home, or to get along with other people? Okay, so if you checked any of the problems, how difficult have these symptoms made it for you for work, for caring at home, or to get along with other people? Not at all, somewhat difficult, very difficult, or extremely difficult. Okay, so if you answered from 0 to 4, that's mild anxiety. 5 to 9, I'm sorry, let me say that again. 0 to 4 is minimal anxiety, minimal. 5 to 9 is mild anxiety. 10 to 14 is moderate anxiety. And 15 to 21 is severe anxiety. Okay, so if you're in the moderate or the severe anxiety range, then it's probably a good idea for you to talk to someone. All right, next. All right, I think we talked about this already. These are just some of the symptoms that can happen with anxiety. We talked about gastrointestinal involvement, such as some students have diarrhea, nausea, vomiting, gas, bloating, constipation. These are all symptoms of anxiety. I used to have kids that would run races that would have diarrhea right before or after, nausea. They would puke as soon as the race was over. Muscle aches, we talked about that, and an urge to void. If you're going to the bathroom a lot, that might be a sign that you have some mild anxiety. Next. Okay, so risk factors, I think we mentioned a little bit about this. Trauma is a major risk factor for anxiety. Stress due to illness. Some people are coming to college with major issues even as young people. So illness can be a major factor. Having blood relatives with anxiety. Okay, remember I talked about the whole idea that there is generational trauma that's been passed down, and mom and dad suffer from anxiety. There's a good chance the kid will have anxiety too. Personality issues is referring more so to those that have dependent personality disorder. They tend to be very anxious, scary people that are afraid of everything. Anxiety is one of those conditions where, early on in life, if your mom and dad are hovering over you, doing everything for you, the helicopter parent, those kids don't really learn how to depend on themselves. They don't learn how to be tough. They haven't been given the chance to struggle. So personalities can set in of being dependent, being avoidant, questioning your ability. So personality can be a risk factor too. And of course, there are kids that are out there just doing every kind of drug you can think of. So drugs and alcohol withdrawal is especially alcohol withdrawal, that can produce, if they're really into alcohol, it can produce delirium, tremors too. So next. Okay, I wanted to show you this video. I hope it will work. Can we play this video?
I guess it's not gonna work, Dr. Gilbert. I'm
Okay.
clicking on it, but it won't do anything.
Okay, then, all right, that's too bad. All right, next. So let's talk a little bit about the interventions, what we can do to help students that are suffering from major anxiety or even depression. So because the pandemic had sequestered us in the home, you're now dealing with students that are 2 years behind emotionally. That connectiveness of going to school, interacting with adults and other kids is a factor to grow students emotionally. And you know, some kids, you know, like I had some kids that were so socially phobic that the pandemic was actually okay for them. They were fine staying at home and taking classes. Some of them had some major problems just finding material online, but that was a relief for them to not have to be in the setting with crowded classrooms and noisy other students. But then there were those that were people persons. They get their energy from being around other people. Those are the ones that really suffered from being in you know, at home, not being able to go out. But just the uncertainty of the pandemic, just not knowing what was going to happen. Was I going to die from it? You know, there was a lot of fear. Fear is a factor of anxiety. So trying to help them now to come out of that and to reconnect with individuals. I'm hoping that schools will have small groups, support groups that where students can really talk about what they're experiencing and get feedback from other students that are in the same boat, so to speak. So increased connectiveness and support is the key to addressing the mental health issues of youth in America. And this is written by the CDC. This is what they promote. Next. Some of the interventions we could do is, like I said, programs that promote social emotional learning, promote self-awareness. You know, kids talk about self-aware. Oh, I'm self-aware. You know, I know how I think, but sometimes they don't. Sometimes they do need that adult to point out, you know, your behavior kind of tells me that, you know, you're feeling lonely or anxious or whatever you're observing. So promoting self-awareness and self-management. A lot of them want to do what everybody else is doing and they don't have boundaries around their own behaviors. Being responsible for your decision making is very important to students to realize that some of the decisions you're making is actually exacerbating your mental health. And involving trained mental health professionals such as yourself, getting timely mental health screening. You know, that's a really hard one because sometimes we just don't know when we should report something. You know, the mass shootings that we see, I always wonder, okay, somebody must have seen this man or woman in the early stages of their thought process, and why didn't someone say something? So just being self-aware of what students are talking about and what they're posting online, because a lot of times they tell on themselves. I'm not really a big social media person. I don't have Facebook and Twitter and all that kind of stuff, but I think if I did, I would be really trying to see if I can pick up on words or phrases that people are using that might give me an idea of what kind of mindset they're in. And then we talked about this, identifying at-risk students. Okay, students are coming to college with mental conditions, and we have to really tag those people and bring them in, have them come in to counseling. Go around to the classrooms and offer your services, and you'd be surprised. I taught mental health nursing for a while, and whenever I would describe certain conditions, the students after at the break, they would come up and they say, you know, Miss Gilbert, I have that. I know I have this. I really think I need some help. And so that one-on-one, they'll open up and they'll start telling you things. Next. Okay, so specific interventions for anxiety. Students should not avoid what's causing the anxiety. I know that sounds counterintuitive, but remember I said that when you have an anxious personality, it's because you haven't proven to yourself that you can do certain things. So avoiding the stressor is just another way of avoiding growth. Number 2, build your strength by facing what you fear the most, okay? Within reason, okay? I'm afraid of snakes, but I'm not gonna put myself in a snake pen. So within reason, encourage them to strengthen their inner self. Seek help of a professional, of course, that goes without saying. And then cognitive behavior therapy is a good therapy to use. Just Socratic questioning, ask them questions and have them work out some of in their own mind what they think they should be doing. EMDR, we talked a little bit about, that's that eye movement desensitization that we use for trauma. And then sometimes kids are so stressed out, test anxiety, they can't take the test, they're failing classes. That might be performance anxiety, and they may need some kind of medicine to help stabilize them. Okay, that was a typo right there. And then spiritual healing, okay? Encourage them to believe in their higher power. I'm a believer, and so I pray with some people. If they're atheists and they say I don't do religion, then of course, I don't force anybody. But spiritual healing, the Bible says, and Jesus said this, he said, be anxious for nothing, but by prayer and supplication. He said, make your requests be made known unto God. So prayer, mindfulness, and then what I do with a lot of my people is I teach them how to breathe, because when you are in a state of anxiety and distress, slowing down your breathing will slow down the release of those chemicals. It will calm down that sympathetic response that we get as we get triggered and threatened. So deep breathing through the nose, pursed lips, letting it out very slowly. Don't have them do this too fast because they will pass out. It does slow things down. It brings down the blood pressure and the pulse. And encourage them to do that even while they're in class. Just help them to take hold of their own behavior, to believe that they can self-soothe. Next. Okay, that was it. Thank you very much. I hope I didn't keep you too long. Wasn't too boring. So any questions? I see one question here. No questions. Any questions you guys have about anything that we just discussed? And I think you can unmute yourself, probably. No questions? Well, I thank you very much for listening, and I hope that you enjoy your work, that you're not doing it for one person, but you're doing it for generations of people down the line. God bless you. Hope you have a wonderful day.
Thank you so much, Dr. Gilbert.
You're welcome. You're welcome, Jay.
We really appreciate it. And I know that what you talked about, it kind of tied in with what our first speaker spoke about as well. So I know y'all are hitting on some of the same things in the same subject areas.
Yes.
But if we do have any questions, you all, I don't know, I know I selected for you to be able to chat with everyone. So if you want to chat, you most definitely can.
Oh, okay. I think, is there a raised hand? No. Okay. Well, I don't see anyone saying anything on the chat, so maybe things were okay.
Okay.
All right. Well, you guys have a great day, and I hope hope to see you again soon. I didn't see the gentleman right here. I didn't get your name.
Hi, I'm Corey Bailey. I'm the Senior Admissions Coordinator at Mississippi State for 2 of our academic colleges. But State and Area Initiatives is my board appointment with the Board of SACAC. So me and Terry Henry, we collaborate on this particular committee. And so drive-in workshops and state meetings fall under State and Area Initiatives. So I'm just here offering support for Jay today and officially giving a thank you on behalf of SACAC and the State and Area Initiatives to you and our other presenter for taking time out of your schedule to not only prepare for this session, but to also actually present and help our attendees as well. So thank you for that.
Yeah, my pleasure. It was really good. You know, it's different talking to people in person versus at a computer, so that takes a little getting used to. But I'm glad to be here. Okay. Well, if you don't have any questions, I'm going to sign off, and I hope you all have a great day. Okay.
Thank
All
you,
right.
Dr. Gilbert.
Yeah. Bye.
All right, everyone. We do appreciate you again visiting with us this morning and taking time out of your day. Like I said earlier, please continue to watch the weather. I know some of you may be getting out of school early, or you may already be out of school. So please stay safe, you and your families. Corey?
Just wanted to say thank you. I put it in the chat, but thank you so much, Jay and TJ, for arranging this meeting today. We really appreciate the work that you put into that. And for those of you who are still on the webinar, you will receive a survey in the coming days from Diana, our executive assistant from SACAC. She'll send that out. So please fill that out. It's a very short, maybe will take you a minute to fill out. And also in that, if you need to request CE clock hours, there's an application in there for that as well. So all of that will be in that follow-up email. We would love to get your feedback so that we can continue to improve this event. And if there's a topic that maybe wasn't addressed today, but that you would like to see us cover next year, feel free to share that with us as well. We want to make sure that we're meeting your needs and helping you be the best that you need to be.
All right, you all, thank you so much. I hope you have a great day. Go forth and be great.